Well, I went to college and medical school in Miami, so on a daily basis you're confronted with dichotomies of society and looking at how different people receive different types of care, for better or for worse. But one of the issues that we're going to have to deal with as a society going forward is variations in the delivery of medical care. As we push forward with healthcare reform and trying to improve the quality in our system, we really are going to strive to decrease the variations both in the delivery and the cost of care. I took that going forward to New York, where I'm doing my residency now at Hospital for Special Surgery. And with the resources there, we were able to begin working with large databases. I enjoy the large database work because I see its relevance on a public health basis. As a surgeon, you're essentially confined to one patient at a time when you're in the operating room, but as a health services researcher, I can try to impact an entire system of care. Well, since my time in medical school, I started to be interested in healthcare disparities and access to care. And one way I've learned to apply that is through the field of health services research, essentially studying the way that we deliver care. In the current study, we've built up towards this study. We're looking at a large database of hip fractures in New York State over a 16-year period, which allows us to look at about 200,000 patients, which gives you a lot of ability to answer questions, or at least to raise further questions that can be answered in more clinically oriented studies. Right now we're looking at predictors for delivery of care and looking at how changes in the resources in the community may affect the delivery of outcomes. Well, hip fractures are probably the biggest public health issue we'll see as orthopedic surgeons. Affect a tremendous number of patients every year, and the incidence has been quite high in the last and slightly declining in the last few years, but it's still a big public health issue. With this particular study, we're looking at whether certain patient characteristics, such as the number of comorbidities that patients have, or even where they live and the type of communities that they live in, may affect the delivery of care. So how efficient the care system is in making sure that they receive the appropriate treatments. And also looking to see if we can detect a difference in the outcomes based on the characteristics that the patients and the communities where they live have. I think in order to continue to push our field forward, we need to ask the questions. And one of the great things about the training that you get in residency and through programs like the OREFs is to learn how to ask the question and how to answer the question. I think that process is intellectually very stimulating, and it'll continue to move our field forward. And there's nothing like asking a question and getting the answer to it. It's kind of like the satisfaction of doing a surgery and getting your results right away. I'd like to continue this line of research going forward in my career. I've been fortunate that the Department of Orthopaedics at Washington University is pledged to be very supportive of my initiatives going forward. I'd like to continue to work in health services research and health policy, specifically looking at access to care within hand surgery, and trying to see if we can improve our delivery systems, not only in hand surgery, but throughout orthopedics. At some point, funding from an organization like the OREF does allow us to have credibility among our peers, showing that the orthopedic community supports our research and understands that this is an important type of research going forward. And my mentors have told me that seeking research funding through a mechanism like the OREF is essential to getting further funding and future funding from the NIH and other extramural mechanisms. I think at this point we have to be in control of our ability to fund our own research. The national funding mechanisms are drying up, and this is really an opportunity for us to invest in our own future and to invest in our young investigators. And without that opportunity to have the recognition from their own specialty that their research is valued, it's going to be very challenging for us to compete with other specialties for funding from the NIH and other large mechanisms.